My name's Samantha Scholtz, and I'm a psychiatrist, a consultant psychiatrist. I work in a weight management service, so a tertiary service, which is in the NHS, which provides bariatric surgery for people, but also provides non-surgical weight management interventions. So things like Ozempic is one of the non-surgical treatments that are sort of coming online now across all weight management services, really. So we provide the psychological support for people pre-intervention and during the intervention and post-intervention, whether that's surgery or medication. I also work as a general psychiatrist. I also see people with other mental disorders as well. And as you can imagine, in the weight management clinic, probably the similarity how you've just discovered, people come from all sorts of backgrounds and have lots of different things that might have led them to come to the point of weight management. So they may have mental health issues or may have no mental health issues. But I think universally, people usually have some kind of emotional relationship with food. And so that's often sort of coming up in the things that the interventions we provide and the support that the education and support we provide people with through the course of their treatment. So I've been doing that for about 15 years. And I also have done some research looking at the neuroscience of eating. So kind of understanding how the bariatric surgery, for instance, changes reward pathways in the brain that are associated with food, and then also other research around psychological characteristics of people going through bariatric surgery and different things that help with people going through bariatric surgery or weight management programs.
I wanted to come back to something that you said at the very beginning, saying that you do come across a lot of times with clients or patients who has emotional relationship with food or some kind of complex relationship with food. Do you find that that's something that they are generally aware of, or it's something that you actually help them discover on their own?
Yeah, so I think it's probably a bit of a mixture. I mean, I think the first thing to say is that having an emotional relationship with food is entirely normal and is a human response. I mean, I think all of us pretty much, I mean, with a few exceptions, you do see the occasional person who really sees food as fuel, and that's the only relationship they have with food. But for the most of us, food carries some kind of emotional response and some kind of emotional relationship. And, that kind of makes sense if you think about it, because we were nurtured with food from childhood and from birth. Our brains are sort of set up and hardwired to see food as nurturing and emotionally nurturing as well as physically nurturing. And also to see food as rewarding and pleasurable substance. So you can see that that's an entirely normal way to view food. And so I think it's really important when we start to think about the relationship with food with people in the clinic that we acknowledge that human response, and we acknowledge the normalness of having an emotional response to food. And then that allows us to start to think about what role that's playing for the person in this particular time and in this particular interaction with whatever intervention they're trying to use to manage their weight or to lose weight. But if you imagine that food is by nature an emotionally nurturing substance, you can also think that at times when we are more stressed or where we are going through a difficult period emotionally, we might draw on that resource more. And so recognizing that is going to be really important in anybody's weight management pathway and journey is kind of working out what are the things that are likely to trigger us using that more, and when does it become a problem. So because for instance, most of us at some point might use food in that way, and we might, having had a bad day, be more likely to eat food that we see as more comforting. But when does that become a problem, and when does that become an issue for the person, and how might we kind of help them manage that? Those are the sort of key problems and key issues. And when might that also tip over into something we call binge eating disorder, which we can talk about a little bit more. So for the most part, I'd say people are usually aware that they have an emotional relationship with food, may be aware that it's problematic for them and that it's getting in the way of them using a weight loss intervention. sometimes are completely unaware of it, but actually through the course of talking about it or through a group intervention where it's brought up, might start to recognize that actually that's something that applies to them, and that's something that might be interfering with their ability to use the weight loss intervention.
And could we perhaps take a step back and explain the difference between the emotional eating and binge eating?
Sure. Yeah. So I think they're on a spectrum, really. And like I said, emotion-driven eating is a normal phenomenon that most of us will experience in our lives, and most of us, probably do for a lot of the time. Whereas binge eating disorder is a very specific disorder that occurs in a much smaller percentage of the population, so something from 1 to 5% of the population. It exists in higher numbers in people who are living with obesity and overweight. The difference really is the extent of the amount of food that people will eat in one sitting. So it's a large amount of binging is defined as a very large amount of food. So usually like a day's worth of food in a short space of time. So usually about half an hour to an hour. And this is really important, with a subjective sense of loss of control. So it's where the person feels they've lost control in that moment. And that implies a sort of compulsive element to it. Feels like you don't have any say in it, that this is something that you can't stop. And often is associated with a sense of, or very often associated with the sense of guilt, shame, disappointment, low mood, feeling awful after the binge, often done in secret and hidden from other people, and often associated with specific types of foods that people might use for binging, although not always. It can be anything. So emotions might be a trigger for binge eating disorder, which is where the sort of overlap with emotion-driven eating and binge eating disorder comes in. But people with binge eating disorder will also say that actually very often that original emotional trigger is no longer there for them, that they might just find that they're binge eating for no reason. There's no discernible emotional reason anymore. It's just that this has become something, a habit that they aren't able to control. In order for someone to be diagnosed with binge eating disorder, it needs to be happening on a regular basis, so at least 3 or 4 times a week. And for a sustained period of time. So again, all of us might at some point or other feel that we have a binge, or might qualify for the criteria of a binge, but it needs to be something that's consistently happening and that's interfering with your daily functioning and impacting on your quality of life significantly. And that would fulfill the criteria for binge eating disorder. And binge eating disorder is a treatable condition. So it's an eating disorder that can be treated with cognitive behavioral therapy and through an eating disorder service. And there's also some self-help things that work as well for binge eating disorder.
And how do I know if my emotional relationship with food is complicated or unhelpful? Like what would help me to identify that?
I mean, I suppose it would be, for instance, if you're using a weight loss intervention and you're noticing that there are times where you are trying to stick to a program, or you're trying to follow certain eating of certain types of foods or certain healthy weight management, a healthy eating plan, and that you're unable to do that because the emotional side of food or cravings or needing to use food for an emotional resource get in the way. So that might lead you to feel out of control with it and might make you feel like you're not managing your pathway or your intervention really well. And that would be a hint, I suppose, that in this situation, it would be something that would be problematic for you. And it might be getting in the way of you doing something that you really want to do, which is to be able to have a better relationship, better, healthier eating relationship. I suppose the other thing is, if you find that you're not able to use other things to manage emotions, that would also be a kind of a key or a hint that perhaps food has become too important in respect of being the only resource you're using for emotional regulation. So, and again, I want to stress that it is probably one of the primary ways that we do soothe ourselves and look after ourselves as food, because that's the way that we're hardwired. But I think that perhaps in the environment that we live in now, where food is so easily available and especially high calorie and highly palatable foods are so easily available, that adaptation that might have been there for good reasons is no longer applicable and can get in the way for us. So we need to sort of really be aware of that vulnerability that we have, and the fact that we live in an environment that's not going to support us using, or that's not going to support us necessarily not overly relying on food, because it's going to be there a lot more. So that recognition is going to be really important. I guess the other thing is that as a society, we sometimes aren't that great at acknowledging emotions, and we're not so great at sort of thinking about how we look after our feelings. And that can be another reason why food becomes a sort of default option. And so one of the ways of thinking about how we might approach this is to really get people to think, what are the ways that I look after myself? What are the ways I take care of myself? What are the ways I nurture myself? What are the ways I soothe difficult emotions? How do I make sure that I'm not relying only on food?
And I'm wondering as well, speaking about how this evolves or develops in us, could you provide a rundown or explain a little bit about why that strong connection we have with food and the soothing through food?
Yeah, so I think one of the things that troubles people who are living with obesity or living with overweight is that although some of the strategies that we might use as alternatives to food, so for instance, going for a walk, simple things like going for a walk or going for a swim or using exercise, may not be as available to people once they've put on a lot of weight or are struggling or living with obesity. And so I think that can sometimes be a barrier to relying or being able to use other strategies. And if your repertoire of strategies gets ever narrower, then the ones that work for you are going to be the ones you become more reliant on, or the ones that are available to you are going to be the ones you're more reliant on. And sadly, I mean, sometimes I see that people are, their repertoire of different strategies have become so narrow that really it is only food that they have available to them. And I think in extreme examples, for instance, people who are housebound, or due to their obesity, that that's really one of the few pleasures still left to them, or one of the few resources still left to them for manage difficult emotions. And then you get the unfortunate cycle that when you're eating for emotional reasons, and then you feel bad about that, and it's associated with a lot of guilt and shame, that becomes a cycle in itself. So that the guilt and shame then drives a further soothing behavior of eating, and becomes a really awful cycle that people feel trapped in and makes people feel very, very unhappy. And so I think one of the things to if we sort of unpick that a little bit is kind of working out why might we have developed this reliance on food? So setting aside the fact that we're all made that way, and that's something that's hardwired. We can also start to think, when did food start to have such an emotional importance to you? And sometimes people can kind of work out from their childhood that there might have been traumatic experiences, or even abuse that might have precipitated, or where food might have been a way of comforting or looking after themselves during those difficult times. Or there might have been situations of neglect or lack of availability of food, or lack of availability of other type of emotional resources, where food again might have become more relied upon as a way of soothing and looking after themselves during that difficult period. So just as an example, I can think of a patient who, this is quite unfortunately quite common, where patients will say that there wasn't a lot of emotional affection in the house, but the one way that care and nurture was shown in the house was through food, and the family would always eat together, or their mother would always make sure that she gave them lots of treats and lots of sugary foods or lots of comfort foods as a way of kind of nurturing and looking after them. And so for that person, food may have taken on an added significance of love and affection, and that can be quite difficult to disentangle from as you grow older, where it's no longer serving you and it's actually getting in the way of you having a healthy life or healthy relationship with food. So sometimes it's important to kind of work out where it came from and how food obtained that significance. But then it's also important to realize that there will be times in your life where that might be more important. So if you're going through a stressful period, or if you're struggling with anxiety and depression, again, food might become more significantly a resource that you might turn to. Or if you have a lot of emotional difficulties with emotional regulation, so emotional dysregulation, where your moods are very up and down for whatever reason, that might be a time that you might also then see food as one resource that you reliably know you can turn to and that's going to make you feel better in that moment. So there's a sort of picking apart the things that might have led you to this point, the sort of working out what's going on right now that might be contributing to it, and then also working out what are the other strategies you've got available to you. What else might you start to think about using instead?
And do you have any practical tips or strategies you would recommend to regulate your emotions without the use of food?
So I think the one really important thing is just try and work out when it is that your hunger or your eating is emotion driven, and when it's physiological hunger. And there are some tricks and some hints that can help you with that. So emotion driven hunger is more likely to come after an emotion, sort of obviously. If you've had a difficult experience or something's gone wrong in the day, that you notice suddenly you feel like you want to eat something, that's more likely to be emotion-driven hunger than physiological hunger, which is more likely to build up over the course of a period of not eating, so over the course of hours, and reach a point where it becomes physically uncomfortable. Emotion-driven eating feels much more sudden. The other difference will be that emotion-driven eating, if you had to ask someone where to locate their hunger, they would usually say it's sort of point to this sort of area rather than their stomach. And whereas physiological hunger, you can often locate more accurately in your stomach area. And whereas emotion-driven eating tends to be satisfied by certain types of foods, so you usually are craving certain types of foods to make you feel emotionally comforted. So, the sort of classic comfort foods, which are more carbohydrate rich, or sweet foods, or chocolate, chocolate being a very common one. Whereas physical hunger is satisfied by a broader range of foods, and in the moment of physical extreme hunger, you'll eat just about anything to sate your hunger. The important thing is that they're not separate. So although we try and think of them as sort of two separate entities, they influence each other, and you're far less likely to feel emotional hunger if you're physically full. So one of the strategies of approaching emotional hunger is to actually try and improve satiety and fullness, which is where medications like Ozempic come in, or bariatric surgery come in, which essentially their main mechanism of action is to make you feel fuller quicker and to make you feel less hungry, physically hungry. So if you cover that base of physical hunger, you don't eliminate emotional hunger, but you certainly reduce it, and you can reduce the intensity of it. Whereas similarly, if you're starved and feeling hungry from a physical point of view, and this is where dieting can sometimes be unhelpful, where you're overly restricting your calorie intake, then actually that can cause you to have more episodes of emotion-driven hunger and more cravings for certain types of foods. So one of the strategies that you might approach trying to manage emotion-driven hunger is to make sure that you're eating. So to make sure that you're eating regular meals, that you're eating enough food to feel full, and perhaps even focusing on the type of food you're eating to try and promote satiety. So more protein-rich foods, for instance, more fiber-rich foods, and less of the very refined carbohydrates, which will give you a sort of temporary satiety, but not long-term satiety. So that strategy, from understanding our physiology, you can start to manipulate our system to kind of try and make sure that you're less vulnerable to having those periods where you're emotion-driven, where you're feeling emotional hunger. The other important thing I was going to say about emotion-driven hunger, the difference between emotional hunger and physiological hunger, is that with emotional hunger, it often feels almost like a desperate need, like if you don't have it, you're going to feel really lots of distress and lots of stress. Whereas with physical hunger, there's usually a level where you can tolerate it, and you know that as long as you know you're going to eat at some point, you can kind of manage it. Emotional hunger feels much more desperate, much more a need for immediate kind of relief. So I think that's one important. So when we think about ways strategies, one strategy is to actually take care of the physiological hunger and make sure you're managing that base, that you're not operating from a place of starvation or calorie deprivation or non-satiety, because that would make you much more vulnerable to emotion-driven eating. And then the second strategy is to start to think about what are the other things that you can do to look after yourself, to take care of yourself. I don't know if you, Nikki, what sort of things would you do to look after yourself from an emotional point of view? If you don't use food, what would be your other?
That's a great question. So usually I would start by trying to identify what's happening in my body, what's driving this behavior, because creating that awareness is I find, very, very important step to reduce that reactivity, basically. So what we very often recommend is to take a pause, take just a few seconds and ask yourself what's happening. Am I hungry? If I'm not hungry, what's going on? What emotion is there? Like, am I stressed? Am I anxious? Am I feeling lonely? Do I need some, reassurance from someone else? So we try to identify what emotion is present and perhaps suggest some strategies based on that. So for example, if you find that your emotional eating occurs during the evening times when you are alone at home, perhaps putting yourself in a social situation like calling a friend or just having a chat with someone might help reduce that. So it's oftentimes about investigating a little bit, diving a bit deeper to see
Sorry, Nikki.
Oh no, you're probably right. Keep carrying on. I was just going to say that when we try to create a pause, we sometimes agree on a few quick action steps to take to distract yourself, to see if that distraction does the trick. But this is how we would approach these things.
Yeah, I think those are all excellent strategies. So you've kind of mentioned identifying what the emotion is. So it's identifying, working out what's going on for you. What is the feeling, which sometimes for people is quite hard to actually work out what they're feeling. They might just be feeling overwhelmed, but not be able to pinpoint that actually this is stress, or this is anxiety, or this is depression, or this is low mood, or this is loneliness. Like you said, I think loneliness is an excellent example. So I think you're absolutely right. So there's the sort of identifying what the feeling is, what might be the precipitant, what other stresses might be going on that they might be able to kind of manage or reduce. And I really love the fact that you use that word pause. I think that's a really, really good way of kind of highlighting one of the really good strategies for this, which is mindfulness. And mindfulness gives us the possibility of a pause. So what that's, I mean, in essence, mindfulness is a skill or a strategy or a skill that we can learn that allows us to have a little bit of a mental pause and to be able to evaluate what's going on for us without jumping in with a reaction. So, and when you have that pause, you've got more possibility of being able to respond. And when you respond to your emotions, you're much more likely to do something that's going to create a long-term solution. Whereas if you react to your emotions, which is where often eating is a quick reaction to emotions, you're less likely to find a long-term solution and to actually respond to your real needs. So as a sort of good example of that, like you gave a really good example of that. So if you're feeling lonely and you identify that you're feeling lonely, if you have the pause to kind of work that out, you might then think, well, what would be a way of responding to that, which is connecting with people, as opposed to reacting to that, which is immediately feeding yourself and with food to kind of squash down that emotion or kind of anesthetize that emotion. So I think your example is an excellent way of kind of working out what are the things that we'd be thinking about that would help people, the steps that we would do to kind of help people learn some new strategies in that moment.
And would you use mindfulness in your practice as well?
Yeah, I definitely do. I mean, I think it's really important to say mindfulness is not a cure for anything. It's a tool, but it's a really good tool. And when it comes to thinking about how we might manage emotions in general, it's really good to have lots of different tools and not just one thing that you use. And mindfulness is a really good tool because we know that it kind of works in brain pathways that act on a sort of top-down way, on the more reactive brain pathways. We have the pathways of reactive food, for instance, those hedonic pathways. Mindfulness, we know, acts in a different way and can regulate those sort of reactive pathways that make us want to seek out something to satisfy a craving. So it's a really good strategy. And it doesn't, I also think it's really important that we don't create too much mystique around mindfulness or kind of make it feel like an inaccessible thing, because it can be something that people can access quite easily. There's lots of apps these days. And really, I think the important thing about using mindfulness as a strategy is that you try and do something regularly with it. As long as you're and I talk about it quite a lot in the same way that we would talk about physical exercise being, exercising a muscle. I think mindfulness is almost like a brain pathway that we exercise. And the more we use that brain pathway, the better access we've got to it when we need it. So I think that's a really helpful way to help people think about it. But that's one strategy. The other strategy that you pointed out that's quite good is being able to work out when are your danger periods. So when are the periods, we all have times that we're more likely to be able, to be vulnerable to emotionally, and often it's the evening. The evening time is often a time that people will say, it's sometimes it's to do with that feeling of like, now's me time. I'm sitting down, I'm relaxing, more likely to have some space to think about how to look after myself. And that's often the time that food becomes the easy way that we do that. And again, nothing per se wrong with that, as long as that's not interfering with your plan that you'd had in place. So if that time is leading to you then grabbing a whole bag of crisps and not being able to stop and skipping a meal, then that's probably not going to work well with your management plans. So, but you might think, actually, I know that's my risky time. So how do I plan in something that's going to be satisfying and look after me during that time food wise? And how do I also make sure I've got some other things in place? Like you mentioned, hooking up with some friends, or making sure you've got a social engagement in the evening. That would be a really good strategy, because it's looking after the actual need and not just reacting to the emotion at the time.
Yeah.
So, yeah.
I like that. I like that you mentioned that, once you identify your danger times, you can actually plan that into your days, which makes it really much more tangible, not just this mysterious thing that just happens to you and you have no control over. That kind of gives you the sense of control again, because you know it's going to happen and you have the control over it, in a sense that you can plan for it. And that's really great. Yeah, that's really important to recognize.
Yeah, and I think the mention of control is really important, because I think that a lot of what makes people feel so distressed about emotion-driven eating is that sense that they have no control over it, that it's something is governing them, and that they are at its mercy. And I think it's really important that we sort of dig into that a little bit and think about that. And as you say, try to help people put in place sustainable changes that they're going to be able to kind of keep going with long term, because there's no point you say, well, when you experience emotion-driven eating, what I want you to do is sit on your hands for 20 minutes. I mean, it's not a crazy strategy, because actually we know that 20 minutes is the time that's often cravings will kind of dissipate after 20 minutes. So it's not a ridiculous strategy, but it's not necessarily the most sustainable long-term strategy that people are going to keep up. Whereas, as you were saying, kind of trying to build in some social things in the evening, that is much more sustainable and much more potentially something that people can invest in more easily. And as you say, there's something about giving people the sense that they have agency over their life, and helping encourage people to feel empowered around that, to know that this doesn't have to be something that runs your life. That actually, once you understand the physiology, once you understand how your brain's working, once you understand how you're interacting with your environment, that you can then think about how you make changes that are going to work for you. So I think that's really important, that we kind of give people back that sense of agency, responsibility, and ultimately, some control.
The lack of control comes up very, very often, because it does feel like, when we are emotionally reactive to food, like it's just something that's so overpowering that we have no influence on it, which is very understandable for multiple reasons. However, give like working out some strategies that gives you that agency back, I think it's a big win. It has a very strong motivational effect as well on clients. patients.
Yeah, and I think there's also just acknowledging there's not always going to work, and that's okay. And that, you know, with any kind of change in behavior or anything where you're trying to break a cycle, especially a cycle that might feel addictive, it's important to acknowledge that it doesn't happen in the first go, and that there might be lots of tries and then lots of times that where you have to restart, but it's in the restarting that people are able to make long-term behavioral changes. So helping people kind of just take a step back and realize that it might not work the first time, and you might have to sort of continuously go back to the drawing board and think, well, what do I do differently? How do I kind of plan this differently? And not to think that all is lost, because sometimes one of the worst traps people find themselves in is that sort of all is lost trap. So I've had a time where I've kind of I've eaten for emotional reasons. I feel out of control. You know, there's no point now in carrying on. And then I mean, one of the things we know about emotion-driven eating and binge eating disorder as well is that it often is one of the biggest barriers to people sticking with any kind of intervention, weight management intervention, because the feelings of guilt and shame are so overwhelming, and the feelings of having been lost are so overwhelming that people often give up with whatever else they're doing, and that can be one of the most damaging aspects of it. So. And again, our role as the person helping them, or you know, the role as the coach, or the role as the psychologist, or whoever's, or a family member, whoever's alongside them, is to, with compassion, acknowledge that it's not always going to be the first time that you get it right, and that there will be times that we are human, that this is a human response, that by nature, therefore, there are going to be times that we'll react in a way that we wouldn't be happy with, but that's okay, as long as we keep trying to do something different, and keep trying to kind of notice what's happening, go back, think about what happened there, and think about responding in a different way the next time. And that can be really empowering for people as well, if we just acknowledge that it isn't always going to be a one size fits all, or even a single intervention that's going to make the difference.
Yeah, absolutely. And I like the analogy that you used before when it comes to the mind being a muscle. So you have to train it. You have to go back and keep training it so it becomes stronger and stronger, which is very true for a lot of the strategies that we discussed. Yeah,
and I think with habits, one of the other things that happens with emotion-driven eating is sometimes the link to the emotion often gets lost as well. So this happens more in binge eating disorder, where the behavior itself almost is detached from the original reason why you might have used food. So people will often say, I'm eating in response to stress, but I don't even feel any kind of pleasure from the food. I don't even feel like I don't feel nurture or comfort from food. It just feels like something I'm just doing out of a habit. And that detachment from the original feeling of why you started doing it can often happen. And in the same way as you're describing, changing a behavior sometimes requires, you know, persistent just switching, because that behavior will have formed over a long period of time through many kind of repetitions of the same thing. And to untrain yourself requires many repetitions of doing something different. One of the other things that happens when you're trying to train yourself to do something different is it's uncomfortable. I don't know if you've come across this with your patients, where people find it's actually really feels quite hard to change. I don't know if you've noticed, so that people might know all this, but actually find the changing behavior actually quite difficult. I don't know what your experience of that's been.
Absolutely, yes. So what I usually encounter is that, you know, we know what would be good. We know, like, we are all smart people. We know that it would be better to go out on a walk as opposed to, you know, running to the fridge. We know that. Everyone knows that. But getting into that mind space and actually doing the action is a whole different level and new story. So that's creating that link is very difficult.
Yeah. And I think part of that is acknowledging that change is not comfortable. So it's not going to be a moment of, there's not going to be initially anyway a sense of pleasure in going for the walk, or a sense of enjoyment, or even you might not even feel a sense of accomplishment with that, because it might be that, you know, going for a walk, you manage literally around the block and that's it. that can maybe feel like you haven't achieved much. But I think it's really important that we sort of almost help people cycle back a little bit to what is achievable, what is the small step that I can make, and so that because often the barrier is that the change that's required feels so overwhelming and so big and such a huge shift from where they are now that it feels like it's too much. And so really dialing it back to like, what is the first little step, and getting people to feel confident with that small step, even though that step may have absolutely no impact on their weight, absolutely no impact on the amount of calories they're burning. It's the fact that they've made a step that's different, and that they've got you've kind of helped them step out of a zone that felt comfortable but not happy, wasn't making them happy, or felt like the default position. And so there's a lot of just acknowledging how uncomfortable that is, and then thinking, what are the small steps that are achievable that will start to help me feel confident that I can do this. I've got this. I can manage these all of these little steps that are going to lead somewhere else.
Yeah, it's building up that confidence that it's going to work. That takes some time. And essentially, I suppose, one of the challenges is the fact that we are talking about changing a comfortable behavior to an uncomfortable behavior initially.
Potentially uncomfortable, yeah, potentially uncomfortable. That's right. And we just need to be honest about that. There's no point pretending it's going to be not uncomfortable. I think the other thing is what's contributed to that very often is people have had so many years of experience of making behavior change and not seeing any long-term results, because the thing that we're sold is that if you do all these little things, then you're going to have this much weight loss and your whole life's going to be changed. And actually, that's just not true. So physiologically, that's just not true. So if people make small behavior changes, they will stabilize their weight. They will have a healthier relationship with food. They will start to feel more confident in their ability to make behavior change, but they're not going to lose lots of weight. And I think that's really important that we are honest. And that's not because people aren't trying or doing the right things, but it's because there's a physiological pushback that our bodies do when we lose weight. And that's where things like Ozempic and bariatric surgery really are effective, because they challenge that physiology. They are physiological interventions that push back against our normal physiology, so that we don't have that weight regain, that we are actually able to lose weight and sustain that weight loss. And so one of the things that's helpful when we're thinking about the role of these medications, to say, well, actually, we are thinking about putting something physiological in. And that's what's different from all the other times you've tried it. Mm-hmm. And so in this situation, we're thinking about, well, we've got the physiology in, but we know that if we don't get the behavior stuff right as well, that's going to count. We know that if emotion-driven eating is one of the reasons people don't do as well with Ozempic, for instance, we know that it can counteract the effects of Ozempic. We know that binge eating can counteract the effects of Ozempic. So if we're putting in a physiological intervention, the difference is we've actually got a better chance of having some weight loss, and putting in the right behavioral strategies alongside that, you're going to enhance your chance of success with it.
And there's also something else that comes into my mind when it comes to taking GLP-1s, whether it's Ozempic or liraglutide or any of them. If I'm using food as a coping mechanism, and I start taking semaglutide, all of a sudden that coping mechanism is not there anymore, because I'm satiated, I'm full, I'm happy with it. However, then I need to reach for another coping mechanism because the emotions might still be there. So how would you manage that, or what are some strategies around it?
I think that's a super important point, Nikki. I mean, it's such an important point, because what you've said is, we're artificially removing a thing that for most of us is an emotional resource, and we're making that no longer necessarily an option. And we see this a lot in bariatric surgery, which is obviously a more definitive, you could argue a bit more invasive intervention than Ozempic. And people lose the emotional resource of food, and that opens up a void. So not for everyone. Some people are, quite able to kind of use other things. And if anything, the weight loss itself might open up more opportunities to do things like exercise or socialize or, work again, other areas that might give you some sort of sustenance or emotional sustenance. But for some people, as you say, there's this sort of emotional void, which can feel quite tricky. And what we see then is that sometimes people might either start eating again despite the fact that they've got the Ozempic or the bariatric surgery on board, and might start using food in an emotional way again, or that other things could creep in as alternatives, such as, and unfortunately we see this in bariatric surgery, that there's an increased risk of substance use disorder after bariatric surgery, because substances sort of, we can hypothesize might for some people replace that. So substances like alcohol might replace that emotional sustenance from food. Also, what we sometimes see is increased rates of self-harm. So where someone's got emotional dysregulation or difficulty managing feelings, and self-harm is one of those ways that they might use to manage feelings, that can increase after bariatric surgery, for instance, where if food's no longer available as an alternative strategy, as an emotional resource. Things like gambling can increase. So there can be sort of unhelpful things that increase, or we might see relapse in terms of weight regain. So those the possibilities. So again, same principles apply. It's how do we bolster the other ways of looking after yourself emotionally? How do we kind of make sure people have more strategies available to them to take care of themselves emotionally? And how can we make sure that people use the opportunity that weight loss gives to enhance their other strategies? So like exercise, like being able to connect with people, like being able to engage in creative pursuits, like being able to perhaps do artistic things or go back to work again, see more family, those emotionally sustaining things. And then I think there's also something about going back to simple things as well. Like, what are the things that you and I might do, like taking a bath, or, doing some meditation, or, tidying up can be quite a useful strategy if you're feeling stressed or overwhelmed. So just really digging down into reading a book, what are the things that really might either provide some distraction or some emotional self-soothing, and how do we kind of make sure that we work with people to kind of explore what that might be for them.
That's a really great point. What I'm hearing sometimes, people who start on semaglutide, they are almost always really relieved because the food noise stops, the craving stops, the emotional eating stops, and that's really liberating, because some of them really do feel that control for the first time in forever, maybe their entire life. So what's end up happening very often that, they are so happy and relieved, and they believe that semaglutide somehow cures these behavior elements. But from our conversation, it sounds like it's still very, very important to address those behavior elements, even if you don't feel it now, because semaglutide helps on that. However, it's still there, and it's still going to come up in one shape or form in the future, perhaps.
Yeah, and I think also knowing your vulnerable times is really important. So like you said we've talked about the sort of daily times that might be more tricky, but also, if we think back in your history, when were the times that you were more likely to gain weight? What was going on for you then? And often you see that actually it might be hormonal times, so times that where women, for instance, had babies or went through the puberty or go through menopause. So knowing that those are sort of trigger times for weight gain, how do you plan around that? Again, comes back to the point of planning around. So how do you prepare for that and make sure you look after yourself during those periods and go back to the basics of regular meals, making sure you're doing exercise. And I do think this is a lifelong struggle for all of us. I don't think that any of us have got this all worked out. And I think sometimes that's the trouble with weight management is that people often are sold a little bit of this is the magic bullet to all of life being better, and that if you just lose weight, you got this. But actually, for all of us, there's a constant process, or for the majority of us. Some people are lucky and their just temperaments are such that they never have ups and downs emotionally, but for the majority of us, we have times where things are stressful. We have times where you might emotionally feel more up and down for no discernible reason, and we all have a job of kind of looking after ourselves and knowing what are the things that help us, so that we can look after ourselves long term, not just in the short term. And the same thing applies for people going through a weight loss journey. The weight loss is going to be there but you're still going to be left with, how do I manage weight maintenance long term? What are the strategies that are going to help me with that? And how do I look after my emotions long term? And what are the strategies I'm going to employ for that? Because those are the times you're going to be vulnerable to weight regain. And we know that times like bereavement, for instance, is a key trigger for weight regain after any kind of weight loss intervention. And it's not so much in the bereavement that people have started emotionally eating as that perhaps they're not taking care of the basics anymore. They're not looking after making sure they're having regular meals, making sure they're getting good sleep, making sure they're actually getting out and getting some fresh air and some exercise. So when the basics go, and when you don't have that base, that's the time you're much more likely to then start reaching for the wrong thing at the wrong time, because you're just reacting in the moment. And so I think there's something about getting people to really realize that these things and these behavioral strategies are long-term life interventions that we're all using all the time, all failing at very often, and that's okay, that as long as we keep going and we keep getting back on track with them. So that it's not seen as like, once you've lost weight, that's it. You know, it's all solved.
Is there anything that you find that would be very important to talk about as well that we haven't really covered?
Yeah. Oh, yes. So I think there are some really basic strategies that everyone can use to kind of help counteract this. So the first, is we've talked about already quite a bit of detail, is tackling the physiological hunger and making sure you don't find yourself in a situation where you're not where you're starving hungry. So in this respect, actually, physiological hunger is your enemy. So you want to make sure you're eating enough food at regular intervals, so you're not leaving long periods where you're feeling hungry. And you can experiment with this yourself. So you can give yourself a day without eating, or half a day without eating, and see how much more likely you are to grab for the wrong types of foods and to overeat, or to eat a bigger portion than you might have eaten if you'd eaten at regular intervals. So even though eating at regular intervals and fighting satiety by eating to the point of fullness might feel like you're having more calories, you are much less likely to engage in emotion-driven eating or binge eating disorder. And we know this from research. And therefore, you're much more likely to feel like you're in control of this process, and that you're managing it and have a sense of agency and a sense of competence with it. So that's the sort of number one, taking care of the basics, making sure you have regular meals, making sure you're eating to the point of satiety, that you're eating foods that are going to make you feel full, rather than the foods that are going to spike your blood sugar and then give you a craving afterwards, which are the more refined carbohydrates. So eating the more satiety-producing foods on a regular basis, and not leaving long spaces between your meals, scheduling snacks if you know you're prone to snacking between meals, actually taking control of that and saying, I'm going to give myself a snack, but I'm going to choose what that snack's going to be, rather than leave it to fortune. So those strategies, that's the number one, getting the base level right, the base level hunger kind of under control. Number two is thinking about, if you find yourself in a place where you are likely to react, or you're emotion-driven eating, seeing if you can have that space, like you were saying, seeing if you can nurture develop a bit of space to be able to think about it before you react. But if you are finding yourself in a reactive place, have you got on hand some things that you know are less likely to be damaging? So some foods that perhaps they're healthier snack options for you, or foods that you know you can more healthily engage in if you are going to eat in the moment. And if you can, there's quite a bit of evidence that response prevention strategies, so that distraction techniques of 20 minutes, is useful. And so with the distraction technique, it's really helpful to say, I'm not saying that I can't have it, because again, that seems to set up something for us. If we deny ourselves, we're much more likely to rebel against ourselves. So, but saying I'm going to allow myself that, but in 20 minutes time. So I'm going to give myself some space to do something else, distract myself. And then if I still want it at the end of it, I'm going to go back and have it. And very often that will be enough that the craving, the peak of the craving will have reduced, or the peak of the emotional kind of energy, or the even that it's a dopamine craving essentially, is trying to satisfy our dopamine. Usually after 20 minutes that subsides a little bit. And the other thing that allows us to do is to notice that feelings subside. So feelings come and feelings go. They don't stay with us always. And even though, because we have a tendency as humans, when we feel a negative emotion, to pay attention to that and to then think that is us. So I'm feeling depressed becomes I am depressed, becomes I'm a depressed person. And what mindfulness and what giving yourself some space to notice feelings but not engage in them is, it gives you the practice that actually feelings come and go. And that you might feel low now, but in 20 minutes time you might not feel low. And yes, you might continue to feel low, but you might also not continue to feel low. And if you might feel anxious now, feel very stressed right now, but tomorrow you may not feel like that. And noticing that feelings come and go, rather than paying attention to them and feeling like they identifying completely with them, is a really important strategy to starting to manage your own feelings and starting to navigate your feelings and not get bogged down in necessarily reacting to every feeling you have. So those response prevention strategies of the 20-minute distraction, or the 20-minute giving yourself 20 minutes before you engage in the reactive behavior, that can be a really good tool as well. And then there are also some really good books that you can read. So there's Overcoming Binge Eating by Christopher Fairbairn, which isn't written for emotion-driven eating, but contains a lot of the information that we've talked about today, and contains a lot of strategies that you can implement, which are very similar for binge eating and for emotion-driven eating. So I think that's a really good resource if people are looking for something they want to start themselves. And that's also something that you could potentially do with your health coach if you're working with yourself, for instance. That's something that you and the patient could work through together. And it doesn't need to, you don't need to go to an eating disorder service to do that. It can be done with someone who's, as long as you've got someone with you to do that with you, you can do that quite well. And you can also do it alone. And the other really good book is The Compassionate Mind Guide to Beating Overeating by Ken Goss. And that's using a compassion-based approach, which we've talked about a little bit, trying to be compassionate to yourself, not getting into that all or nothing pattern, and not beating yourself up if you fall off the wagon or you don't have bad days. Recognizing that we're human and that we and learning and compassion. The other thing compassion-based approaches do is start to think about how we nurture ourselves and how we look after ourselves, and recognizing that in a lot of us that parts of our emotional repertoire is not well developed, because we don't as a society train people well in kind of looking after feelings. We're not particularly good at that. I think we're getting better at it, but traditionally there's been a sort of sense that we react and soothe feelings potentially in unhelpful ways, like food or alcohol, or we don't accept feelings and kind of take care of them as well as we should. So compassion-based therapies and compassion-based approaches are really another really good way of kind of looking at emotion-driven eating or binge eating disorder.
Thanks for that.
So those are very useful to start.
These are very, very useful, definitely.
Yeah, good.
But thank you so much. I really appreciate your time as well. It was so helpful.
Thank you as well.